Computer. Welcome to the Manifesting Health Series. I'm Curry Bordelon, your host for our discussion. Manifesting Health Series provides engaging interviews with experts in men's health. Today, we're excited to have Blake Smith join us for this episode, Data-Informed Decision Making. Blake is a clinical documentation senior analyst for Nebraska Medicine in Omaha, Nebraska, immediate past president for the American Association for Men in Nursing, and current president-elect for the Nebraska Nurses Association. Blake is a visionary leader for diversity and inclusion within healthcare and beyond. Welcome, Blake.
Hey, it's nice to be here. I appreciate the invitation.
Excellent. Thank you so much. So as we get started, tell us a little bit about, your background and what got you in data. How did you become so interested in data and how that helps in healthcare?
I think that's a loaded question. Because when I started out nursing, I was not thinking about data or technology at all, other than the fact that it was part of my workflow, part of my daily job of utilizing technology when it comes out to take better care of our patients. But I think as I was going through grad school at UAB, what really stuck out to me, even though I was on the track for health systems administration, I just came to realize how important the understanding of decision making is by having data and not using anecdotal, qualitative uh, information alone to be making decisions. Because to be successful, to be efficient, and truly be a great steward of the funds in a nonprofit, because that's what a lot of health systems are, you need to use your funds wisely. And in order to do that, data is everything in regards to making those decisions. And if you don't have it, it increases your risk of implementing incredibly complex and expensive workflows, uh, and then having a higher incident of failure. So I really wanted to go in that direction. And whatever I ended up doing overall, you know, in my career, I wanted to have a true understanding of being able to understand and analyze the data to make good decisions.
And I want to continue that thought a little bit more. And can you tell us a little bit about where we are? Where are we right now in both technology and information sharing? Where are we in a space that data is so important? How are we using data as it should be or shouldn't be?
Yeah, so data in itself is a umbrella term, right? Because you're like, what data? How are we utilizing the data? How do we collect the data? And I think sometimes when we're on at the bedside or whatever role we find ourselves in, we kind of just let technology and data kind of go above our heads, or we see it in dashboards. We don't know how it comes about, etc. But in healthcare, you know, I'll start out that we understand if you were not using EHR systems already, you're one of the few that is not. Because the 2023 report from the Office of National Coordinator for Health IT found that 96% of hospitals now are on EHRs or electronic health records, and do not do any type of paper process at this point. So, right there, any type of documentation, discrete data input, what we call it, is sitting in the electronic health record, and health systems utilize that data for many things. And that includes telehealth and remote monitoring, artificial intelligence and machine learning, robotics and automation, mobile health apps and digital tools, big data and predictive analytics. And so that really means trending data and making adjustments to workflows for efficiencies based off actual data. And so there's so many things that we do in the health system field, at the global level, that I think a lot of times nurses don't realize that it's not just documenting, right? We're doing it for a reason. And I know that's hard to hear sometimes. When I was at the bedside, I didn't want to hear that. But it's incredibly important because it will impact you specifically and how you can take care of your patients more effectively by implementing tools of value and not of ones of, ooh, there's the shiny squirrel object that looks cool but does not help us in any way.
So I'm glad you mentioned that. You and I we're both part of large academic health science centers, and so for us, that data it drives all the things you mentioned in a very powerful way and predictive and so forth. But also our research arms. So I know that it's incredibly important that we're not only getting data, which is in itself is one thing, getting the data or
Mhm.
receiving the data. How do we make sure that we're getting good data? Like how are we taking it to a place where we have, warehouses full of data that we're receiving from clinics, from patients, from, outpatient, from surgical procedure, whatever it might be. How do we get that data to a place that's usable?
That's a great $1 million question. I think it really goes back to the problem, right? What is the problem? And there could be many different types of problems depending on what we're trying to accomplish. But I think a lot of times we lose track of what are we trying to accomplish, right? And a lot of implementations, what happens is they're like, oh, we need to track this for this certain CMS protocol, Joint Commission, et cetera, without understanding what are we truly trying to solve, or what is Joint Commission or other regulatory agencies really trying to track and solve the problems that we have towards whether it's patient safety, whether it's patient throughput, whether it's just overall quality of care. And so when teams that are doing project management work or quality improvement work of implementing anything, they have to have a true understanding of what we're trying to solve. Because if we don't have that, you're not going to get good data. We need very specific data and understanding of the metrics before and after so that we know what we set out to do, we accomplished, right? And that also then provides you the ability with that data or with the proof to your team members of, look, we implemented this and you've now saved 15 minutes in the chart that compared to what you had before. So now you can take care of your patients better. Look, our medication errors reduced by 10% or more because we implemented this work part of the workflow that helps you take better care of the patient. So when it really boils down to is the problem we're trying to solve is to take care of our communities better, right? That's the pie in the sky idea. But there's many little things in this complex health system that we have in our country that we have to be very diligent and very intentful in what we do. And the only way to do that, in my opinion, is to have quantifiable data that is inputted into the system by our staff with that workflow, and then has a valuable output, which is the process of putting it onto a dashboard so you can trend data or whatever actionable item you're doing with that data. If you do not have an action to utilize whatever you're inputting in the system, you need to question yourself of why are you even capturing that data in the first place. So that's where I think the difference between good data and bad data is really about understanding what you're trying to solve and be efficient in how you're trying to bring that value to solve that problem.
You bring up really good points in this, and we're in this space now talking about artificial intelligence and all these different
Mm.
things that can help large language models and so forth that can help us process large volumes of data. But the reason I asked about the good data, bad data, if you will, like what you mentioned, is exactly that. Those tools that are out there that other tools or the analytic tools are only as good as the data that gets put in. So I'm really glad that you talked about that differentiation and identifying the end result. What are you looking for? What are you trying to accomplish? So in the next couple of minutes, I want to talk a little bit about how that data can help us bridge gaps in disparate populations or those populations who are missing the same level of care. For example, men, we already know the data is out there talking about men routinely live 7 years shorter period of time than females because of health disparities, because of lack of consistent preventative care and so forth. Can you talk about how data can help us bridge the gap within the male population to improve those outcomes?
Yeah, I think that the way we find out how men access the healthcare system or how they navigate can be utilized. The process can be utilized for any type of population. It's just about what are you, again, trying to identify and solve. And the biggest thing is first we need to understand why men don't even go to the doctor. Is the first thing, which is hard to capture if they're not within your system, right? But you could, for those who do access your health system, whether it be their own fruition of wanting to do it, or their wives are dragging them to the health system because they've got this growth that, oh, it hurts now and now we can't do anything about it. That's usually what happens with men, is they wait too long, and why we see our mortality so significantly different from our female counterparts. I think the first thing is meeting. You have to meet whatever population you're trying to serve where they're at, and that's not exclusive to the healthcare world. That's exclusive with any type of communication, and understanding what their needs are and how they want to consume the information that you're trying to provide. So that's the first piece: is how do they consume the information that you're trying to provide them, whether it's education, whether it's your primary prevention type stuff, and really trying to locate that data. How do we go about collecting that data first? Okay, what are those data points? And then taking that, do we have them already? We just need to, maneuver it so that it's a little bit easier to discern and kind of what we call scrub the data of trying to find those trends for baseline data. And then you go on a quality improvement project and say, now that we know the baseline data, we're going to implement this one thing and try to reduce the variables as much as possible. And then you trend the data after you implement that and say, hey, did we make a positive impact here? Um, and you can do that through quantitative data, or you can do that through also a layer of qualitative data, which is, feedback or testimonials or any of those types of things for those that may not know the difference between quantifiable data and qualitative data. And you take the feedback, you evaluate, and if it moved the needle, let's move forward. What more can we do? Because I think the biggest barrier that I've seen in my experience with men is that they they just they wait too long. They have this we have this stigma about ourselves, like we got to be the rock. We need to help everyone out, but we don't understand, and I say we because I include myself in that. We don't understand that we have to take care of ourselves to be able to take care of others. And I say that's true for nurses in general as well. We're horrible at it. So, you and myself, Dr. Bordelon, like we got the double whammy that we have to be completely aware of. And so that we are practicing what we preach. But I think from a data perspective, we have to use what we have now to identify the gaps and then intentfully implement new workflows, new ways of reaching out with information to draw and provide the need for them to see value in getting into the health system earlier so that they don't have these really significant mortality differences or just morbidity, not just mortality, than our female counterparts, because they are accessing the healthcare system, and you can see it in the results.
Uh, so important that you mentioned that, that is the big gap, is that preventative care piece, and not realizing that that little bit of prevention can go a long way, and not have that, months down the road, I've got this new pathology, a mass or whatever it is, and now I guess I need to go see. Well, it's already gone past stage 1 and 2. Now you're here.
Hmm.
So
Hmm.
yeah. So this has been extremely helpful. I really appreciate your expertise and your thought in this. But I do want to, as we close out in our last few seconds, what little takeaway, what sort of words of wisdom do you have for our listeners?
Well, I think when it comes to technology, is it's not going anywhere. So we as nurses need to understand that. And in this age of incredible acceleration of technology and innovation, it can be scary. The unknown is scary. A lot of us are scientifically, logical individuals that need that the unknown is not the easiest for us, and so technology is not helping that, right? Because it's very fast, and if you don't have an understanding, and I'm not saying understand where you're coding or anything like that, but an understanding as a nurse of how these innovations can potentially help you or assist you, to better take care of your patients, that is going to be the key for success going forward. And for all of those out there that think right now that AI is going to replace nurses, that is not the case, in my opinion, and what I'm seeing. We don't know the future, but that is not the models that I'm seeing. AI is specifically for assisting for accuracy, validity, and further assistance to our healthcare professionals so that they can focus on the relationship much more. And whether that is from diagnoses accuracy, whether that's through assisting through automation and AI looking that they could look at non-discrete fields. So you could write in your progress note, your care plan note, and it could actually read those things, which we could not do before. And so I'll leave it with this. AI or machine learning is not going to replace nurses, but it will replace nurses who do not embrace technology.
Thank you again for your time and your expertise. I really appreciate it. You've been listening to the Manifesting Health Series webinar, and we really appreciate your time and look forward to seeing you next time. Thanks.